Again, we can treat with behavioral management. It's surprising how much you might think that behavioral management won't work, but it actually works really well. We can look at the things that might be setting it off, then use medicines, and then start progressing down the path, if required, to those other treatments. Here is another thing called a cystocele. This is a bladder. The front of the body is there, the back's there, the back passage is here, and the bladder is dropping into the vagina, and that's called a cystocele or a prolapse. Now, many women who are older will have that with no symptoms at all, and that's not a big deal at all. It's only if it becomes related to urinary function that it becomes worth treating. This is called a flexible cystoscope, where we have this little fancy little flexible telescope that we can pass into the bladder just with using a little bit of anesthetic jelly, and we can inspect the bladder very carefully, and you can walk in and walk out and have that inspection done just to work out where everything is. This is a little bit more involved. Sometimes in people who leak urine, we can pressure test the bladder, where we put a little tube in the bladder, fill it with a solution that we can see on X-ray, and then measure the pressures of the filling and emptying cycle of the bladder. If we come to repairing things, this is again the front, this is the back, this is the bladder. We can put little things called slings. They're little tapes made through 1 centimeter incisions, and therefore not big operations. These sort of operations you can have on it as a day procedure, where it just supports the bladder and stops it dropping, which then would set off the leakage. And there's another example of the bladder. This is actually more male urethra, and again a sling is through there to stop leakage. Other things that if you look up a water pipe with a telescope, which people like Nada and I do all the time, this is getting to the neck of the bladder, and the dark spot which doesn't have any light is the bladder because the light hasn't got in there yet. And this ring structure should be closed, but it's open, and that's why it's leaking. So sometimes through that telescope we can pass a little needle and put these little cushioning, bulking agents in there to just close it. Think of a donut and just making that donut a little bit fatter. And what we're doing there is we're just trying to close that to control leaking. Sometimes we unfortunately have to resort to catheters. These are these little tubes that sit in the bladder. We can use a little balloon to stop it falling out, and we drain it to a small bag, either through the tummy or through the urinary passage, because we just need to get the urine out. If I move briefly now to urine infections, this is a picture of bugs in the bladder, and these can be very bothersome. Basically, a bug gets in the bladder, and it causes the bladder to become very red and raw and very, very uncomfortable. The things that you might feel would be sometimes, just out of the blue, you'll start going often. You might just sense a lot of pain down there, whether you have the pain all the time or whether you have the pain when you're passing water. You may pass blood, you may even pass pus if it's getting really bad. You sometimes get very sick and develop a fever, and sometimes that infection can go all the way to your kidneys. Although sometimes you can have no symptoms and still have a urine infection. It's not a sexually transmissible disease. Urine infection is not that, but a lot of people think it is because it is related to intercourse in many cases. The penis going in and out of the vagina can milk bugs back into the bladder, and if you don't empty the bladder afterwards, that can set up an infection. That can be related a little bit to estrogen with aging, and sometimes there's a structural issue. So hence the caption, "Not tonight, I have a sore toe." Because what she knows is that if it happens tonight, she's going to have a bladder infection tomorrow. We treat infections with antibiotics, sometimes short-term, sometimes long-term. We sometimes use investigations like ultrasounds to see that's a bladder there. That's all the dark stuff's the water in the bladder. And sometimes, as I mentioned, we pass little telescopes into the bladder just to look for things that might be setting off the infection. And naturally, if we find a cause, like a stone somewhere or a structural defect, we try and treat the cause. And coming back to basics, one of the things that do matter with infections is that if your bladder can empty adequately, if there is a precipitating cause, that you just empty the bladder after that, like after sexual activity. And if you're wiping yourself, it would be reasonable to wipe yourself front to back rather than the other way around. So I hope that was a nice thumbnail sketch of these issues. I'm happy to take any questions, but I'll leave you with that thought.